All right. Well, welcome. Suzanne here with Dr. Chuck Reinertson from Lifetime Dental and Your Filthy Mouth. No matter which stream you're watching from, we're glad that you're joining us. We do this every Thursday at 5:30. And Dr. Chuck had to work really late. We made it right to the last second because you were seeing a patient and you came out kind of like, I want to talk about what I just saw.
Well, this is one of the things we try and get across to people, just how important the health of the mouth is for the rest of the body. And the fact that 90% of dental infections have absolutely no pain. You don't even know what's going on. And nice patient that I just saw had no idea that the gum situation is as bad as it really is.
It didn't hurt. There were no indications, nothing.
No. Well, I had a way a long time ago, but nothing hurts. And if you lose teeth, that's one thing. But if you're dumping harmful bacteria into your bloodstream, this is doing things to the inside of our body that it's just not healthy. So it's nice to be able to educate people and let them say, this is what's going on right now. This is what's going in your blood. I was like, oh my gosh, really? Yeah. So lack of pain does not equal health. And that's a real big point right there. People think if it doesn't hurt, it's fine. Your physician may ask, how's your mouth? Oh, it feels fine. Okay, good. And you move on. Feeling has nothing to do with it.
Oh, wow.
High blood pressure, diabetes, glaucoma, cancer, no pain. So just because it doesn't hurt doesn't mean everything is okay.
So there's a campaign and it talks about feeling whole. So when you say it doesn't really matter how it feels, if you can see that there's issues.
If I get in a room full of midgets, I'll feel tall, okay? It won't make me tall. So, right? If I get in a room full of people that are severely obese, I'm going to really feel skinny.
Sure.
It's not going to mean I'm skinny. So feelings have very little to do with our health.
Wow.
You know, we have to work on the health part right there. And a lot of times just because you feel fine doesn't mean you are fine.
Well, I think there's some danger a little bit in us looking at our mouths and going, no, everything looks good. I don't see anything. I don't see any cavities. I don't know. I don't know. I think it's probably a good idea.
Well, a physician cannot do a good, thorough oral examination without the proper instruments, without the proper radiographs or x-rays. You've got to be able to see what's going on. And some of this stuff is under the gum, and you can't see it without the proper equipment. And that's why it's so important to have a thorough dental examination from a qualified dentist. You know, like I've said before, there are good dentists, there are other than good dentists.
Right.
There are good physicians, there are other than good physicians. There are good attorneys, there are other than good attorneys. So no matter what profession you're looking at, make sure you find a good one, because I mean, there's some excellent ones out there, but you got to be careful.
So I heard a case recently that somebody was experiencing headaches, and it ended up, it was their bite, and it had nothing to do with, high blood pressure or anything like that. What does the bite and a headache, or the mouth, let's keep it more general, and headaches have to do with each other?
Well, people think about the mouth, they think about three things. They think about your smile, chewing, and speech. You know, when you lose your two front teeth, you kind of talk funny, Christmas, you know? But there are three other things that are really important for the mouth. Number one is infections, either from the teeth or the gums, because that infection goes into your bloodstream and affects your whole body. That's one thing. Number two is the airway. So many people have some type of sleep disordered breathing. Seems like the number one solution with that is a CPAP. Well, that's great if you're going to wear the CPAP.
Sure.
But if you're not going to wear it, there are some oral appliances that can open up the airway and help you breathe better. And the third thing is the way the teeth come together, the bite. The gears have to mesh a certain way. And if they're not meshing, they've found some nerves in some of these posterior, these back teeth, that it's an interesting pathway that work their way around to some of these muscles in the temple, in the back of the neck. And you can have headaches, neck aches, all kinds of things. And it's just from the way the teeth come together. If you've had orthodontics, if you had your teeth move around, you've got these humps and hollows, and now you've moved the teeth around to where they look good. But how would they come together now? Because that could have changed. A lot of times it used to be, they would, I call it 4 on the floor. You take out 4 bicuspids. You'd measure the teeth, measure the arch. If there wasn't enough room, you took teeth out to make them fit. Well, when you do that, you've shifted everything around, and that can affect the bite. And when you affect the bite, that affects, like I said, a lot more than just the teeth. You can chip teeth and break teeth if the bite's too far wrong, but if you're not chipping or breaking, you can have headaches, neck aches, and these other things. And by simply getting the bite adjusted the way it's supposed to be, as long as the jaw joint is healthy, okay, because that's got to be taken into consideration too. As long as that's healthy, it's amazing how, gee, you don't need those medications and the headaches have gone away.
And you can check that. You can check like clicks and things if you're with your jaw and everything.
Yeah, and here we do a CBCT where we can do x-rays of the jaw and see exactly what's going on with that. Sometimes you need an MRI to look at the soft tissues, to look at the meniscus is called up in there.
Mhm.
But you want to make sure that you've got three things that are working together: the jaw joint, the bite, and the muscles. All three have to work together. And if one of those is off, it affects the other two.
And then I imagine another reason people could experience headaches from the mouth is from grinding their teeth at night. They don't even know they're doing it.
That's it. One of the theories is that our subconscious is trying to grind the right bite in for it.
Oh, so
you know,
they come together.
yeah.
Sure.
But then people deal with stress in different ways. Some people get ulcers. Some people get high blood pressure. Some people grind their teeth.
Mm.
And it's just the way that the body is dealing with the stress. If you are doing that, you need to make sure that the teeth are properly adjusted so you're not damaging your teeth.
Mhm.
You know,
I eat chips, by the way. That's how I don't grind my teeth, but yeah, I deal with stress.
plenty of chips.
Plenty of chips. Yes. When you see those empty bags in our living room, you know it's been a bad day. So. But we've got the question of the week, and PJ was asking. He wrote in and said that he experienced his grandmother having problems with her teeth,
Yeah.
and was asking, is there anything that he can do as a young man? He's in his early 30s. That he can do now so that he doesn't have to worry about going through, wasn't just the expense, but he saw her going through a lot of pain.
Oh
with
man,
teeth.
the quality of life.
Mhm.
You know, when you're younger, you think everything is going to be just fine.
Right.
But the older you get, some things become more important. And sitting down and enjoying a meal with the
Mhm.
family,
Mhm.
you know, is a nice thing. If you can eat. If you
Sure.
can't eat, then you got
I don't want to just eat soup when I'm old.
Yeah.
You know?
So, well, the first thing you have to do, and I've said this before, is really find a qualified dentist and get a good dental examination to find out what's going on, because you can't tell looking in the mirror. You can't. I can't tell my own. I have to have my teeth examined just like anyone.
Sure.
You know. But so get a good examination and then do what they tell you. It's a matter of getting things healthy in there, but what you do every day, that's the biggest thing.
Mhm.
What I tell our patients is that you can do more good for you than we can do for you. It's up to what you do at home.
Mhm.
And I tell them, I said, look, I would much rather have you spend your money on a vacation for your family
Mhm.
than here in the dental office.
Right.
So I'm talking myself out of work, but what's best for the patient?
Sure.
And the only way that's going to happen is if they do their homework and follow through and take care of it. And this is a daily thing. And then seeing the dentist on a regular basis. Regular depends on what you need. For some people, it's twice a year.
Mhm.
For some people, it's once a year.
Mhm.
For some people, it's 4 or 5 times a year. So it all depends on the situation.
You know, as a dentist, you hold your patients accountable. I mean, there's a responsibility that we have that we answer to. I mean, not in a mean way. How long have you been flossing? But you want us because you care. You know.
When I was in dental school, there was a sentence we all learned. It says, "There's nothing the dentist can do that will overcome that the patient will not do."
Mm.
And that is so true. We can't, if you're not going to do things for those the time you're home, we can't make up for it here in
Right.
the office. It's got to be a daily habit. And what I've been saying, I've changed my tune from what it was years ago. What I'm suggesting is thoroughly cleaning your teeth one time a day. But to thoroughly clean your teeth takes 5 to 10 minutes. You can't do it in 2 minutes. You can't do it in 30 seconds.
Mhm.
And the way you do that is clean your teeth as thoroughly as you can. Chew up one of those little disclosing tablets, which are available. They're over the counter. They're inexpensive. Chew up one of those things, swish it around, then take a look inside your mouth and see where there is stain on your teeth. That's where you have to go back and brush that off. We're getting back to the basics. But your question was, how can you avoid the problems that his grandmother
Right.
had? This is how you do it. It's inexpensive, but it does take time.
Mhm. Well, we want you to check in with yourfilthymouth.com. There is so much information on there. We can't begin to explain to you how many shows there are. And I mean, there's shows like how to handle your mouth care when you're pregnant, and if you're going through chemotherapy, and if you have a mature mouth, an older mouth. So many great episodes, and we'd love for you to go on there, check it out, yourfilthymouth.com, and share the information.
Yeah.
You know, it's difficult because if you have family or friends that have bad teeth and they're on medication, I so want to just say, what if it's happening in your mouth? What if you get off some or all of your medications because what's happening is from bacteria in your mouth? How do you have that conversation?
Well, sometimes you have to go out on a limb and just say, have you seen a dentist lately? And I say, but a good dentist lately. Have you been following up with your treatment?
Sure.
And
sure.
if you've been following up with it, then you want to make sure and take care of it.
Right.
But if not, encourage them to follow through and get things all taken care of.
Sure.
It's a personal choice.
Mhm.
Dental care is not expensive. Dental neglect is very expensive.
Mhm.
We don't want to go there.
No, we don't. All right. Well, you can listen to Dr. Chuck every Monday, WQBQ 1410 here in Lake County. And I think we've got a question or a comment. Just go ahead and say it. Okay. The question is, I clench my teeth at night. Hi, Suzanne. It's nice to see you. Suzanne said, I clench my teeth at night, but I don't grind them. I do wake up with headaches often. What would you say to Suzanne?
Well, I know we don't realize that we're not grinding. We don't always know what's going on. Sometimes you can make it's called a night guard. It's a piece of plastic that you put down your clothes on that, and you can see what's happening with that. Sometimes that will help. I'd rather see you grind on the plastic and wear away the plastic than grind on your teeth and wear away your teeth. So sometimes, but you have to be evaluated and kind of see what's going on. How do the teeth come together? It's funny. We can take models of people's top and bottom teeth, you put them together and you can move them around. You can see just where the teeth fit together. And you say, are you moving your teeth this way? Oh no, we never do it that way. And you can see the wear patterns. And it's like, oh my gosh. Well, the only way you're going to wear this way is if you're doing that. And so, clenching and grinding are different. People clench, and if you can clench on a piece of plastic, sometimes it's not as damaging as just clenching tooth to tooth.
And it'll show you proof of what you're actually doing instead of what you think you're doing.
Well, that's where you use ribbon in there and check, where are you hitting? Where are you not hitting it? So, and you want that to be pretty even. So as far as the bite, because if you're hitting one side before the other, that can affect the jaw joint. Like I said, everything has to work together in harmony. Great question, though. Yeah.
Suzanne, thank you for checking in. Suzanne's a Jersey girl who moved here to Central Florida. So we'd love to know what city you're listening in, what city you're watching in. And, we've got your Filthy Mouth coffee mugs. We'd love for you to ask a question and you will get a coffee mug. Matter of fact, Suzanne, you're getting a coffee mug today. Yay. So I'll get in touch with you, let you know how to make that happen. So thank you so much for watching and being here. Thank you, Dr. Chuck. And we're doing this now, right?
Yeah. I'm staying away from that Corona beer, though. I can tell you.
And there goes their stock, right?
Yeah.
Have a great day. We'll talk to you next Thursday.
Thank you.